hit anything, it stops. Well, good day, everyone. Welcome. It's so good to see all of you here joining, and I know a lot more are coming in now. It is an absolute delight to see you all today. I just want to share a few words before we get started with our presentation today. Thank you for joining the Vanderbilt University School of Nursing Global Collaborative Series, a platform dedicated to exploring diverse landscapes of advanced nursing care around the world. My name is April Kapu. I'm the Associate Dean for Strategic Partnerships and Global Affairs here at Vanderbilt, and I will be moderating today's session. Please let me take a moment to thank a few people. First, Megan Allen. She is a DNP leadership student and has helped very much with putting on this series. And I also want to thank all of our colleagues and coworkers who have worked so hard to develop and implement this program. The purpose of this series goes beyond borders. It is a journey to learn, to understand, and to foster connections that may lead to meaningful collaborations in the realms of advanced nursing practice in education and regulatory frameworks. This series serves as an open invitation to communicate, to share experiences, and to collectively contribute to the enhancement of advanced nursing care on a global scale. As we embark upon today's series, we'll be using Zoom as our format. I kindly request that you keep your microphones muted during the initial portion of the presentation, and this will ensure a smooth experience for everyone. Now, rest assured that there will be an opportunity to engage with questions and comments once the presentation concludes. And now, without further ado, let me please introduce our esteemed presenters for today, experts in the field of nursing who will guide us through valuable insights and perspectives. First, we have Dr. Ruth Kleinfeld. She is currently the Associate Dean for Clinical Scholarship, the Independence Foundation Chair in Nursing Education, and Professor for Vanderbilt University School of Nursing. She is certified as an acute care nurse practitioner and has over 25 years of clinical experience in the ICU and acute care settings. She has received federal and foundation grant funding to conduct research related to outcomes after critical illness, patient and family-centered care, and the role of the advanced practice nurse, and even more so in terms of really following advanced practice outcomes. She is a fellow in the American Academy of Nursing, the American College of Critical Care Medicine, the National Academies of Practice, the American Association of Nurse Practitioners, and the Institute of Medicine of Chicago. Next, we have Dr. Wentao Zhao, who is the Director of Education for Nurses CET and Program Director for the Master of Nursing program at the Alice Lee Center for Nursing Studies. As a registered advanced practice nurse, she provides care at the Singapore National Neuroscience Institute. Actively involved in APN development, she led curriculum revisions, collaborated with the Ministry of Health, and initiated programs like the National Collaborative Prescribing Program. Dr. Zhao also contributes globally through the ICN, the International Council of Nurses, NP-APN Network, and serves as the president of Sigma Upsilon Eta Singapore chapter. Her research focuses on APN education, role advancement, practice models, and outcomes. She advocates for a healthy nursing workforce and planetary health. Dr. Bridget Wu is a research fellow at the Alice Lee Center for Nursing Studies, Yu Lu Lin School of Medicine, National University of Singapore. Before her appointment as a research fellow, she practiced at the National University Hospital, Singapore, as a registered nurse for 6 years, during which she was trained as a critical care nurse and worked in the intensive care setting. She continues to retain her professional nursing license with the Singapore Nursing Board after leaving clinical practice. Dr. Wu's research published in reputable journals, including the International Journal of Nursing Studies, Journal of Nursing Management, and Journal of Clinical Nursing, focuses on the role, implementation, and professional development of advanced practice nurses. Thus far, she has conducted nationwide cross-sectional studies and collaborated with the Chief Nursing Office, Ministry of Health in Singapore. She continues to work with the CNO office to affect change in policy through research and evaluation. Apart from advanced practice nursing research, she has conducted research and published work on integrating and optimizing care for patients living with atrial fibrillation and with ischemic heart disease. Dr. Wu is also a board member at the Sigma Theta Tau Upsilon Eta chapter and is member of the International Council for Nurses Nurse Practitioner Advanced Practice Nurse Research Subgroup. Please join me in welcoming these experts. Dr. Ruth Kleinpel will now launch our presentation.
Great. Well, thanks so much, April. And it's my pleasure to be involved in this session. I had the wonderful opportunity of networking with colleagues from the National University of Singapore when they first started their advanced practice nursing programs. Unlike other countries, including the US, where the APN role was focused initially in primary care, in Singapore, they instituted their nurse practitioner role with inpatient acute care and psychiatry as their first specialty areas. So I had the pleasure to meet the Deputy Chief Nurse of the Ministry of Health, Professor Prema Kanusamy, in 2005 when she visited the United States. She was looking at different models of APR in practice. And so I began to network with her, and she actually had me come to teach in the program several times. And we actually had 6 of their students come and do what they call as an attachment. It's a clinical experience so they could observe APRN roles in the United States. And so over the years, I have maintained collegial relationships and have published and presented with some of the colleagues, and just really have been impressed how they have further developed and enhanced the APRN role. They now have specialty areas of focus, including pediatric, and they've expanded to community and home care, as well as specialty-based clinics. And you'll hear more about that through Wentao and Bridget's presentation.
All right, well, we will go ahead and move. And just so that you all know, some of this presentation has been recorded because it just so happens to be 2 a.m. or 3 a.m. in Singapore right now.
Hello, I'm Bridget. Just like what April has introduced me, I am a research fellow at the Alice Lee Center for Nursing Studies. Today I just want to start the conversation by sharing a bit about advanced practice nursing roles in the community and how we implement it in Singapore. Okay, maybe a bit of a background of the history of Singapore's primary health care. We started in the 1900s where we have mobile clinics, and then we moved on to having more structured outpatient dispensaries and maternal and child health clinics. Finally, in the 1980s and 2000s, we set up a one-stop shop polyclinics, and I think it's something that's quite unique to Singapore, where it is a center where patients go and have their chronic disease sorted out, and they also go there to see the family physicians. Yeah, so it's one place where it serves many purposes, and newborns would go there for their immunizations as well. So of course, in the post 2000s, we have evolved to include more modern clinic technology. So, I mean, it doesn't have urgent care, but most often it's one of the first places that, people would go to have their health checked out if they have, acute illness and all that, because it is situated within their neighborhood. So it's really very close to home. Finally, in 2017, we had a bit of a restructuring of our health system. We reorganized into 3 integrated clusters and 3 different polyclinic groups. So, as mentioned, most people go to the polyclinic to get their chronic diseases managed and sorted out. So you can see that across the years, these are the 4 top conditions of polyclinic attendance. We have hyperlipidemia. We see patients with hypertensive disease, diabetes mellitus, and also acute upper respiratory tract infections. In Singapore, and I also think for many developed countries, these are the 4 things that we see a lot in Singapore. Number 1 is an aging population, where we see people with multiple comorbidities, and this increases healthcare burden, and then more needs to be done to improve overall health. There's, of course, the problem with rising costs. There's greater resources needed for patients with complex needs. Number 3, we have a fragmentation of care. So specialization provides depth of care, but may not be very holistic. It just is mostly disease specific. And finally, with rising affluence and educational standards, patients' expectations are also rising. So the Ministry of Health in Singapore, during in 2018, we had a budget review, and there was this strong call to move beyond hospital to community so that, Singaporeans can receive appropriate care in the community and closer to home. They don't have to travel all the way to the hospital. Next, there is a shift to move beyond quality to value to ensure that we give every Singaporean the best value while keeping our system sustainable. And finally, to move beyond healthcare to health to help support Singaporeans to lead healthier lives. And on top of the 4 chronic diseases that I shared about previously, there is also a looming atrial fibrillation epidemic in Singapore. We see that for people above the age of 70, the prevalence of atrial fibrillation is about 4.6 to 8.2%. It doesn't seem much like that, but oftentimes atrial fibrillation is not being screened. And so there are probably a lot more people having silent AF, and they probably only realize that they have atrial fibrillation when they develop a stroke or something. Between the age of 40 to 69, there's now research showed that the risk of AF is at least 37% for every 5 kg per meter square increase in their BMI. So you can see it's not a disease that is just for the old, but it's also something that would touch the younger population as well if they're not managing their weight well. So this is how atrial fibrillation is usually managed in Singapore. You can see that the different colors represent the different acuity of the patient, and there is no form of structure or segregation at all or stratification at all. We have all sorts of people going into tertiary care to see the cardiologist and to get their atrial fibrillation sorted out. So you can see that it's really not very efficient, and we are getting a lot of patients who are very stable and can be managed in the community, choking up the system within the hospital. So one of the ideas we had, which was based on literature and also on recommended protocols on managing atrial fibrillation, is to implement integrated care to properly stratify the patients and to put patients that are, more acutely ill, to refer them to specialist care in the tertiary care setting. And then to really see how we can shift patients who are more stable into the community. And I think Singapore is very well set up for that because, as mentioned, we have the polyclinic, where it's a one-stop shop where we have the advanced practice nurse, we have the family physician, we have other healthcare professionals like the pharmacists and allied health professionals, and also medical social workers in the polyclinic to provide integrated care for patients with stable chronic atrial fibrillation. So we thought that the advanced practice nurse would be the best person to lead this service in the polyclinic because you can see that within primary health care, the role of the APN essentially is that, is as depicted in this flow diagram. She takes history, she would conduct physical examination, order investigations, interpret results, diagnose, educate and counsel patients, manage chronic disease. They could also manage common acute conditions. They can draft and prescribe medications, initiate and implement treatment. Yeah, so essentially, they hope to empower self-management, identify disease exacerbation, clinical outcome management, and also, of course, monitor risk factors profile. So maybe at this point in time, I would like to share a bit about the implementation process. So at that point of time, atrial fibrillation care was solely taken care of within tertiary care setting, within outpatient specialist clinics. So it's something that is quite novel at that point of time. And so we thought that we had to implement it properly and do a lot of groundwork and stakeholder engagement before, we can implement the service as a permanent one. Yeah. So first, we developed a team in consultation with atrial fibrillation integrated care key opinion leaders. We not including just the Singapore key opinion leaders, but also people in Europe and in Asia. We held key stakeholder engagements within the university and also within the polyclinics. We explored user and stakeholder acceptance. We co-designed the service with clinicians and stakeholders, and also we piloted it and evaluated it. So apart from getting stakeholder engaged, the key stakeholder engagement, such as the clinicians and the advanced practice nurse, we looked at the acceptance of patients with cardiovascular disease, because at that point of time, it's something very new. And of course, the user acceptance is something that we really wanted to tease out and to really find out if there's some concerns among patients. It was during this qualitative study that we found out that there is a lack of understanding of the role of APNs, causing less than optimal patient acceptance of advanced practice nurses. Yeah. But as patients experience improvements to their health through APN-led services, they gain confidence in APN's skill and knowledge. So one huge takeaway from this study was that we had to properly introduce these roles. We had to fully explain, the role of the APN to our target population. Yeah. So this is how our clinic setup was like. And it was, we went through the ideation process with clinicians and our stakeholders. Essentially, the APN would lead the atrial fibrillation clinic. She would assess the patient, she would screen for risk factors, and she would deliver the patient education. The physician, the family physician, would collaborate with the APNs At the point of time when we first started this service, APNs do not have collaborative prescribing authority yet. But as it progressed, the APN has collaborative prescribing authority, then the model of our care changed slightly, and the role of the family physician within the clinic also changed slightly. The care was also supported by a computerized decision support, and also supplemented by a web-based education website that provides information pertaining to stroke prevention and living with atrial fibrillation. One unique thing about this is this was all pre-pandemic, and it went through and also happened during the pandemic. We already had teleconsultation with the cardiologist, so that was great. And we had fast-track appointments for specialized investigations like TTE, like 2D echogram, the 12-lead ECGs, the stress treadmill tests. All these are not done typically in the polyclinic, so we had to refer them to the tertiary hospital to get all these investigations done. But typically when the polyclinic refers the patient for all these specialized investigations, it would take up to 4 to 6 months for the very first appointment in the hospital. But because of this special collaboration between the polyclinic and the hospital, patients could get the appointments as quickly as 2 weeks. So you can see this is how our clinic looks like, the consultation room. This is one of our very first patients. And this is the APN, the very first APN as well, who started delivering this service at the polyclinic. And it was very well received, and received also media coverage in our Chinese news. On the right hand side of the screen, you can see that there's a website that we have developed in both English and Chinese for the patients to refer to when they are at home. So the APN would use this also as a resource when delivering patient education. So of course we wanted to evaluate it, pilot it and evaluate it to see if there's any impact at all on cardio related hospitalization, stroke incidents. So we see that it actually did quite well. There wasn't any stark difference with usual care in terms of stroke incidents and cardio related hospitalization, which is a good thing. So it just shows that it's non-inferior, it's not performing worse than usual care. But we can see that patients really benefited in terms of patient-reported outcomes like quality of life, knowledge about atrial fibrillation, medication adherence, and also their depression scores improved. And because of the success of this service, it was no longer a research project anymore. It was made a permanent service at the polyclinic, and now has expanded to see patients with ischemic heart disease and stable NSTEMI. With that, thank you. I'll stop sharing my screen now.
Oh, thank you. Thank you so much, Bridget. And I believe, let's turn some time over to Wintao. Do you have some additional comments to add?
Thank you, Bridget. I do not have. I think I really thanks Bridget to give an example about the APN services. It's not only the service, it's how the service being established. It's very scientific based. And on top of that, I understand Bridget is continuing evaluating this service together with the clinicians, and they are going to continue to improve the model of care led by the APN. Thanks, Bridget. Maybe I will take on from here to share about the Singapore APN development. Let me share my screen. So I would like to give everyone overall understanding about Singapore APN development. First, in Singapore, APN is a protected title, and we have adopted a hybrid model, which include 80% of nurse practitioner and 20% of the clinical nurse specialist role. So this is slightly unique compared to the other country. So for the NP role, the APNs will provide direct care consult. While for the CNS role, they hold on for teaching and education for fellow nurses. They also do some research, evidence implementation projects, and also support system. So leadership in the way to be involved in the policy making, involved in the guideline making. Then now I move on to give everybody an understanding about the APN development in Singapore. We had established this role in back to 2003. It's almost 20 years from then. The program started actually under the School of Medicine, if you can see here. Is under the Division of Graduate Medical Studies. So at that moment, actually, the training is mainly provided by the doctors. We started with medical surgical track, critical care track, and mental health track. So in 2005, the APN registered actually under the Nursing and Midwifery Act. So we did change our law, and the APN become an official title under the law. In 2006, the criteria for APN certification was drawn up, and first batch of APN certified in 2007. And since then, all the trainings are under School of Medicine. Our School of Nursing, which is Alice Lee Center for Nursing Study, is only established in 2005. So slowly in 2009, the whole APN training transferred back to Alice Lee Center for Nursing Study, which is under nursing training. At that time, we are still keep the 3-track, medical, surgical, critical care, and mental health. So slowly in 2012, the APN training for pediatric was established. And in 2014, we have changed our certification criteria by using OSCE, while before this, we are using the interview case study methods. So the APN need to submit 2 case studies, and there will be an expert panel, about 6 people, include the physician, nursing leaders, and people also involved in the medical field come in to interview the APN. At that junction, the success rate is not that high. So in 2014, the decision has been drawn based on some scientific review. We have adopted OSCE was used for APN certification. So our APN development continues. In 2018, you can see here, we established National Collaborative Prescribing Program, which training the APNs to have the prescribing right and allowing them to practice on top of their license. So till now, we almost have about almost 200 plus have won for the program. It's about 160 plus people, APN already get the prescribing rights. So we continue evaluate and monitoring our certification process, our APN development. In 2021, we have made a decision to change from the OSCE certification exam to some summative clinical portfolio to take over the certification exam process. So till now, I must say we already have 374 APNs in Singapore, registered APNs in Singapore. Then how to be a registered APN? There is quite a long process. You can see from this diagram, if you want to become an APN, you need to actually have meet certain criteria. So first, you must have a degree, and your CAP score, which is your GPA, must be more than 3.2. And you need to have 5 years working experience as registered nurse. And if you come from very specialized areas such as mental health, critical care, you need to have an advanced diploma to enter to the Master of Nursing training to train to become an APN. If you've been selected, then you need to complete 18 months Master of Nursing program. You need to pass the theory test and minimally get a CAP score of 3. And also you need to pass the OSCE exam at the end of the 18 months. If you complete your master program and you can successfully enroll into a 12 months integrated APN training internship. And this 12 months actually allow you go in depth to your specialty. And at the end of the 12 months, based on your build of the portfolio, there will be a summative case review for the portfolio to see whether you have met the minimum criteria to register as APN. Once you successfully register as an APN, the story is not end here. You need to continue to renew your APN license yearly. So every year you need to submit the documents to demonstrate you have sufficient clinical hours and you actually keep your continuing professional education. So this is being captured at Singapore Nursing Board. So in a short time, I just give you an overview of the Singapore APN landscape and picture. Hope that helped everybody to understand Singapore APN development. Thank you.
Thank you. That was a wonderful diagram, Wentao. It was very descriptive of the process. So just to better understand for a particular example, Bridget, you gave a wonderful overview of the atrial fibrillation clinic and having an APN in that clinic. So for that APN to be able to work in that clinic, can you just take us through the educational preparation for that APN? So in other words, a specific example of what Wentao just described.
Yes, sure, April. So this particular advanced practice nurse and including all other advanced practice nurse in the polyclinic, they are trained as a generalist. And maybe Wentao can add a bit more about the educational aspects of how they train a generalist APN. But because she's trained as a generalist, she didn't really have much of a cardiovascular or atrial fibrillation related management experience. So what happened before we set up the clinic, she had to understudy a cardiologist in the hospital for probably I think at that point of time it was 3 to 4 months. Yeah, she was sitting in atrial fibrillation clinics, looking at how the cardiologist manage a typical atrial fibrillation patient. Yeah. And because it was also guided, like atrial fibrillation management is very much guided by a protocol. She had to follow the protocol when she's back at the polyclinic as well. Yeah. Maybe Wentao, you can share a bit more about how we train generalist APNs.
Thanks, Bridget. Thanks for the question. I think if you look at our entry criteria for our students to join for the master program, indeed, most of them, every one of them have 5 working years experience. But of course, many of them are from specialized area. Some are from general practitioner area, such as polyclinic, which is the case of what Bridget has mentioned. She came from the polyclinic primary care setting, so she's very generalist. So she came to the program. The program is very generalized and go in depth to understand the medical components and to help them to have clinical decision making, make diagnosis, and initiate clinical management. But however, we do not go into specialty. So for this particular APN, which Bridget has mentioned, she may not have concrete specialized knowledge. She has a general, but she may not go in very in-depth about cardiovascular, about respiratory. So in this, I think in this attachment, she went together with the physician to specialize, go into study about the atrial fibrillation. So that gives her in-depth understanding for how to manage this group of people from the symptom management until complication management. I think this gives her a broad and in-depth understanding for how to manage this group of people. Because people come in may not be just AF, atrial fibrillation can have other disease. She's at the same time co-management for that. So that is the beauty of the APN. It's not just disease focused, it's really a holistic human per se. So that's how is the approach which shape our landscape of care model from hospital are very specialized focus, while polyclinic are general. But now we start to shift some of the specialty care in the primary care setting, which offload from the acute hospital. On top of that, enable the healthcare provider outside there in the primary care is to really to better fulfill the population's needs. Yeah, so I hope this is give everybody a better understanding. Bridget, if I have missed anything, please feel free to add in. Yeah.
Yeah, no, I think that's great. But one thing that I would like to just highlight, which I forgot in my presentation, is that how this atrial fibrillation clinic is a one-stop shop. So she doesn't just look at atrial fibrillation. She consolidates all the patient's appointments. So she looks at his chronic disease, the patient's chronic disease, and also in addition to that, his atrial fibrillation condition. So instead of having possibly 2 or 3 appointments each time, the patient just have to see that one advanced practice nurse and to get everything sorted out. Yeah.
That is fascinating, and the study was so effective. So you described that by the end, the process was much more efficient, and the wait times went down considerably. I really appreciated that you took time to talk about the patient's perspective and how they came to better understand the APN and the type of care that they provided. So that was an excellent example and a wonderful overview. And so from an education and regulation standpoint, it looks like the education's a lot that goes into the generalist aspect, and then they have to go on and continue towards the specialty. And both are very much needed, as you just described in your example. The regulatory standpoint, the certification, registering with the Board of Nursing, keeping that updated annually is all very fascinating as well. And there's some similarities, certainly as you describe that with what we're experiencing as APNs in the United States. So you mentioned continuing education to stay up to date in terms of skills and knowledge. Can you share a little bit more about what the continuing education process is like?
Okay, Thanks. So in Singapore, for all the registered nurses, we need to keep ourselves for at least minimum 15 hours or 15 credit. There is a way to calculate the credit for continuing professional education. That is for the general registered nurses. Well, for the advanced practice nurse, there are additional 15 credit required for the APN to submit the specialized area training in order to prove actually you keep up to date, you are relevant to what the evolving care in so-called in the healthcare system. So you need to submit to the Singapore Nursing Board. There will have a team of people to review to say the credit you have submitted is relate to your specialty practice. That's to really to show the evidence to say you're up to date. So that is for the continuing professional education. But of course, I think as an APN, they are not only good at their special area, they are leading for clinical service. So the hospital is kind of continuing developing this group of people, sending them for various training, leadership training, evidence-based practice training, although may not be a very structured academic certification, but the training is constantly happen in the organization. Yeah, so that's actually lead to, which I have mentioned, we do realize there is many APNs ask after a few years as an APN, then what is my next level of development? So we are actually looking at the Doctor of Nursing Practice development in Singapore, is to really give all the APNs who are actually work very hard, have contributed a lot to bring them to another higher level, to look at policy change, to really look at implementation, science and research. So that is our next move. Yeah.
So fascinating.
Thank
And
you.
so I thank you so much. And I know we've talked a lot about education and the pathway and some about regulation. Let's take a few minutes to just talk about practice and outcomes, because I was fascinated by the story particular to the atrial fibrillation clinic and how you track the outcomes so that you could really demonstrate the impact of the APN there. So you have 374 APNs in Singapore. So what types of practice models are there? Are they in the hospital and ambulatory and many, many different models? Can you share a little bit more about that? And then I'd also love to hear a little bit more about how you are tracking outcomes of effectiveness.
Oh, that's great. Actually, I do have a slides. Maybe I can share. While meanwhile, to show my slides, I really want to thanks Ruth have contributed to the APN development in the early stage of develop the APN, and also along the way guiding us to how to look at the APN outcomes. So by saying where are all the APN practice in Singapore, if by looking at this diagram, you can see they involve in the adult clinical care, which is really in the hospital setting. They work in emergency care, inpatient care, outpatient specialty care, and also they set up services for transitional care to facilitate patients from hospital to home. They also anchor for primary care. They provide health promotion, disease prevention, and also provide chronic disease management, and also initiate acute health problem management in the primary care settings. And they also drive for community care. You can see they set up and initiate for community care, provide home care, provide consultation for the home care, nurses, and also provide palliative and enough end-of-life care in community settings. Besides just now, what I have mentioned is rather in the adult care setting, there will be also have APNs working in the psychiatric care. They are looking at acute and chronic illnesses for the psychiatric care, psychiatric patients. They are also looking at the young and old psychiatric problems, and they provide care services to immigrants with mental health issues. On top of that, we do have pediatric APNs. They again provide care service as emergency, inpatient, specialty areas, and care transition from hospital to home. And recently, they also established pediatric community care. By looking at this whole chain, the ultimate goal is really for APN to improve the quality of care through many ways: direct care providing, to deliver evidence-based services, and also in the way to discover problems and develop strategies to continue to improve the care of that. So this hope a good diagram to give everybody an understanding for what kind of service they are providing in Singapore.
Many different settings and many different patient populations. So Ruth, can you share a little bit more about what your work has been with Tao and Bridget? And I know you talk so eloquently about outcomes, so a little bit there as well.
Yes, well, thanks, Wen-Tao and Bridget, for that nice overview. And I have had the opportunity to visit Singapore several times and consult. I first came in 2005 when Prima was really helping to establish the program. Prima is one of the leaders in Singapore, initially working with the Ministry of Health for establishing the APN role. And I had the opportunity to come. And at that time, as Wen-Tao had shared, the focus was really psychiatric and acute care. And then over time that they have evolved the roles as well as the specialty areas. But from the beginning, they were very wise at really listening of the importance, in talking about the APN role in the US. I shared the importance that they need to look at outcomes, look at impact in order to expand the role. And they have done a wonderful job doing that, not only raising awareness and doing it well in the community. Their local paper, the Straits Times, has had articles on APNs. It's been on, the news. I mean, they've really done a wonderful job of showcasing. And Bridget has spoken about one role and outcomes, but she has also done that with other roles to look at the outcomes of APN. So I think that, and they continue to do that. So, we sometimes here in the US, we still struggle, to look at outcomes. And I think, collectively, APNs in other countries do the same. But I think, you really have done a great job with that.
Well, you have an absolutely amazing model, and I just want to thank you all for sharing your time and sharing with us a little bit more about the role, the education, the regulatory framework, and certainly the different practice models there. And we would love to hear from our audience. So at this time, we're going to break and open up the floor for questions from our audience. So thank you all for such a wonderful presentation. Juan. Ruth, we definitely want to hear from our audience and would love to hear from you as our expert. So I'll ask for our attendees today, if you would use the raise hand feature or just kind of get my attention so that we can take your questions or comments. And also feel free to put your questions and comments in the chat.
Yeah, thanks, April. They, in Singapore, it's very regulated there. So the role was, initially through as Wen-Tao shared, initially through the School of Medicine, and then it got transitioned to the National University Alice Lee Center for Nursing Studies. But over the years, the Ministry of Health has been very involved in really looking at evolving new roles as a trajectory for nurses' professional development as well. So Megan Allen asked, how is the support of APNs in Singapore from the physician groups? Well, interesting that you asked that, Megan, because they have full support of the physicians. Unlike other countries where there may be resistance from physician groups, there is wide scale acceptance by the physicians. The role was actually developed with input from the physicians because initially they had a lot of physicians in the community health setting, and therefore the need to have APNs manage more complex patients prior to discharge, who had complex wound care or nutrition needs. And so they really welcomed and support the APNs. The physicians are actually involved in their education and training. Initially, they served as preceptors for them, but now that there's a growing number of APNs, they have sufficient APN preceptors as well. Elizabeth asks, are the APNs leading evidence-based practice, quality improvement, and research projects, and are they publishing as well? Well, Elizabeth, you heard a little bit from Bridget, but interestingly enough, the National University of Singapore has roles such as Bridget, who are full-time researchers that are devoted to doing just that. So the APNs themselves probably aren't widely involved. They're encouraged to publish, but they have a very proactive focus within the Alice Lee Center for Nursing Studies, where the faculty, Wentao and Bridget and others are there to support and help them with publications. They do lead evidence-based practice, however, and you heard Wentao say that the role was initially developed as both a NP and a CNS merge type of role. So they're all encouraged to implement evidence-based practice in their specialty areas as well. And that is I think, a unique feature of their role.
And Jessica has a question.
Yes, Dr. Kleinfeld, I was hoping you might know, were there any additional trends in the increased frequency of atrial fibrillation other than the BMI, increase in BMI that was mentioned in the presentation?
Yeah, I would have to look specifically at her article, Jessica, to answer that. So I don't know that intuitively, but if you look up her article, her email is there. She'd be more than
I was
happy
just
to dialogue.
fascinated by that. Yeah.
Any other questions or comments? And Ruth, you continue to go to Singapore.
I haven't been since the pandemic. Yes, they were very specific during the pandemic. Unlike the US, they all adhered to strict precautions, and they did not open up their borders for international travel until most recently. So, but they are hosting the Sigma Theta Tau International Nurse Researcher Conference there this year, actually, and then they're actually having another conference, an educator conference in the spring. So they really are now, getting back to really networking. And Wentao was at the International Council of Nursing meeting last year in Montreal. They're very proactive about speaking about their APN role and what they're doing and evolving. And I'm sure they'll be active in the ICN APN network meetings as well that are coming up. So
very good. And I really appreciate it. And I don't know if this was mentioned, but could you share just a little bit about the book chapter that you contributed with Wentao and Bridget for the International Council of Nursing, really looking at international APN NP practice?
Yes, there was a book that was published this year that was looking at NP roles and highlighting exemplars. And so we had the opportunity to speak a bit about exemplars here in the States, and they shared some exemplars that they have in Singapore as well. So a lot of similarities. They have learned their APRN roles from other countries, including the US, and have modeled, but I think they've added some unique features that are beneficial to their country as well.
Are there any more questions? Okay, well, I'd like to, Ruth, do you have any final comments before I wrap everything up?
No, thank you so much. It was a nice overview. Good to hear from them.
Well, it's just fascinating to hear what others in very like positions are doing around the world. And that is really what this series is all about, to really better understand advanced practice in different parts of the globe. And so I just want to thank everybody for joining today. Please take a moment to fill out the feedback form. We greatly value your feedback. If you have anyone that said, oh, I hate that I missed the session today, please direct them to our website through Vanderbilt School of Nursing. They can just type in Vanderbilt Global Collaborative Series, and they can watch the recording of this series. It should be up by tomorrow or the next day. And then please join us. Our next session will be on March the 20th, where we will be able to hear from our very own alum, Dr. Waikako Eklund. So she worked with us. She graduated from Vanderbilt, and we are absolutely delighted to hear from her as she shares more about the advanced practice nursing role in Japan. So please don't miss that session. Thank you all for joining today. And until next time, stay safe, stay healthy, and we will see you all again soon.